Thank you for coming to our presentation. So we're gonna introduce ourselves, talk a bit about our organization. We're a very different animal amongst men's groups across the country. And we're gonna talk a bit about our projects we're working on. We just got funded quite a bit of money recently, so we're kind of growing it very quickly, which is a little stressful, I must tell you. And then we left some time at the end to ask us questions about our work, how you can work with dads in your area. So if you can, try to hold your questions to the end, and we'll do our best to answer it. So my name is Nelson Rascone. I'm the executive director of Dad's Move and one of the founders. A little bit about me, how I got here. At what, 25 years old, I became a single father, went through a very nasty divorce from my ex-wife who had severe bipolar disorder and who had become a meth addict, which is why I filed for divorce. Went through a year-long battle for custody, got custody, and probably about 6 months after custody, he was diagnosed with mental health disorders. And at the time, I was a driver for Metro, which is the transit system in Seattle. And I got fired for missing so much work, because I live in Tacoma, which I don't know if any of you are familiar with Washington. It's about 45 minutes south of Seattle. And so every time I had to return the bus to the base, I had to fly down I-5 to go rescue my son. And one too many times, they let me go. So that's how I got here. Ended up becoming a real estate agent. Then the market crashed in 2008, and then I started working for social service agencies in our area and working with families like ours. And that's where I slowly met the people in the group that we founded the group with. And kind of the brainchild was probably several of us had been single fathers. Several of us were already working in the system as peer supports, and we kind of observed that every agency, every family-run organization was run by moms. All the peers were moms. And we're kind of like, you know, there needs to be something that does work with the whole family, but comes at it from a father's perspective, that encourages father involvement, not just within the agency or the fathers themselves, but at a systems level. So that's kind of where we started. With that, I will let John introduce himself, and then we'll talk about our group.
Hi, everyone. I'm John Bodkins. I'm from North Central Washington on the eastern slopes of the Northern Cascades in Tonasket. My story started back in '77 when my mother was diagnosed with multiple personality disorder and schizophrenia. So I was dealing with her for most of my life. She basically had a vendetta against me. My life was totally brutal. You know, I already put a PowerPoint together for my life story. It was just a brutal life. And then when I was 27, I had my first child. When I was 28, I had my second child. So I have a son and a daughter. Then I moved to Washington State. I'm originally from Gettysburg, Pennsylvania. I went to military school for 7 years, graduated there, and then moved to Baltimore, Maryland, lived there for 18, 19 years. So, and then to get away from all that, that's how I wound up in Washington State. So in Washington State, I, tried to make vendettas meet, tried to make amends with my mom and mend them bridges, and ended up with my mom telling the police that I was a felon in possession of firearms, wound up in jail, and then she kidnapped my son and took him back across to the East Coast. So after all, that's all still ongoing, some of that, but I ended up in 2010 working for CPS for about 8 years. So I worked with the Department of Child Services. I'm originally one of the founders and started working the Dad's Move, and we started putting everything together. And then I had a brainchild about the equestrian center at my place in Tonasket, and we'll discuss some more of that in the video. That's about it, I think.
Think so?
Unless you want to get into my life story, but other than that.
Well, we'll see how much time we got.
Yeah, right.
All right, so that's kind of a, you know, a snapshot of kind of where we came from. So the big thing is, yes, we are a father organization, but we prescribe to the old saying, it takes a village to raise a child. And all too often that village has not included the father. So we have probably worked with just as many moms as we have dads. It's just, we're a bunch of guys instead of a bunch of moms. So our perspective on child rearing and accessing services is different. So that's, you know, that's a little of what makes us different. Again, we're a family-run organization, but we're all dads. Like I was saying, most of us have been single fathers. All of us that started this organization were involved 24/7 with our children. And several of us actually have more than one child with disabilities. One part of my story I didn't mention is when I got remarried, my wife has 2 children with severe developmental disabilities. So then I had to learn a whole other system. All of us have been to IEP meetings, wraparound meetings, mental health counseling appointments. And again, our core belief is that fathers need to be fully involved in their child's life. How many of you, I'm assuming probably most of you here, have a kid with a disability? It's stressful, isn't it? You have your IEP appointments, you have your counseling appointments, sometimes you have your crisis appointments, and sometimes, unfortunately, the police are called to your house. There's a lot of stress, a lot of things you have to do. And when one person is shouldering that load, it only makes it worse. So we really advocate that both parents need to be equally involved. And I will tell you, the only way my current wife and I made it through raising 3 children that all had complex needs is because we both were taking turns going to the IEP meetings, going to the crisis calls. It's very important. So just a little bit more history about us. This is some of the original members. You can see me, darker hair, of course. So we were founded in 2011. So we've been around almost 12 years now. At the time, I was working as a peer for Catholic Community Services. One of our members was working for a crisis response center. Another one had been working for a children's inpatient facility in Washington, again as a peer. Several of us, including myself, were some of the first male family peers in the state of Washington. And we're really trying to increase that, and I will talk more about that in a bit with our current work. As I mentioned, we serve moms. We get moms calling us all the time. A lot of times it's, how can I get my husband to do this? But, which is okay. The other part in that is we really encourage partnering together for better relations. Again, it's stressful raising a child with high needs. And so we talk a lot about that on how moms and dads can work better together, not just for parenting, but their relationship. So I'll kind of throw this out to all of you. One of our problems is that dads have really been left out in our society. And I've kind of named a few things here, but I'm interested to hear what all of you have to say. For far too long, it's been the societal norm that mom is the primary caregiver and dad works. And if the parents are separated, mom gets the children and dad pays a child support check and has them on the weekends. So as far as we're concerned, we take that, crumble it up, and throw it in the trash. And as a result, so you have that, and unfortunately, we've had a domino effect. Almost all of our workers in our social service systems are females, they're moms. Most dads have not had a good role model. It's generational. Fathers are far less likely to get custody. I was one of the 0.5% in 2001 when I got custody of my son in Washington. 0.5% of dads at the time got custody in our state. So all of these things have played a role. Anyone else have any ideas of why we've left out fathers out of the equation? Don't hold back, even if it's a touchy answer. Yeah. I don't disagree with you. Anyone else? Yeah.
Well, I would say that we work with our families a lot. See that dads aren't as involved sometimes, but also I don't know that like so having to learn how to address the way a male or a dad thinks and also sees things that maybe feels left out, but also some that I think sometimes that material isn't addressing it in a way.
Thank you for mentioning that. That's a good segue to talking about some of our projects we're working on. Go ahead.
I would say, like, in some states, some of the systems, you know, the way the system is set up is for like that, when that trying to stuff. I know in Georgia, like, you can sign a birth certificate and you still not known as a father. You gotta go through a whole legitimation process, like, to be known as a father. I take my children to the hospital, you know, to appointments, and I'm still asking, I go, you know, are their mother aware that, you know, you have them? And I have to sometimes call her on the phone, like, so, you know, she can actually let them know it's okay.
Yeah, absolutely. Back there, then there, and then there. Right.
Unfortunately, within our business we're supposed to be, no matter what. Unfortunately, for the dads out there, it's not seen, not shown, it's not recognized. I feel that it's sad.
Agreed. There and then there. Yep, go ahead.
seen my experience in families and very bad
There, and then we probably have to move on.
Access to certain things because the system has been put in place for me not to access this, but more so for the mothers. So if I would definitely say it's the lack of knowledge surrounding.
Agreed. Right.
I would say that I think some of it too, from what I've seen, is fathers are more resistant on accepting that they don't have a diagnosis, and if they don't accept it, then it's not real, so they just remove themselves in the situation. But they don't have to face reality, and their son or daughter's not what society says they should be like.
Right.
I feel like the failure of the father is over that.
And I agree with all of these comments, and that's why we ask these questions, is we have to have these hard conversations if we're going to get past this. And the other one I'll throw in there is to be honest, our system also has a cultural and racial component added into that on how they view fathers. So we have to talk about all of this. And what I'd say is, dads are just as nurturing as moms. Moms can be just as disciplinary as fathers. Yeah. And I'll just say, I had to learn all this because my story was kind of opposite. My ex-wife, she split. She wasn't involved in my son's life. They reconnected a year ago. He's 26 years old. So I had to learn how to be nurturing, disciplinary, and all of that. So, yeah.
I just wanted to bring out one point. Is a lot of dads, that a lot of dads don't know how to deal with their feelings, don't know how to deal with their behaviors, don't know how to communicate with their spouse. So a lot of dads over the years, they tended to work more and stay away from home and not be at home. So there was another problem. Oops. So there was another problem. I'm not used to holding the mic.
Yeah.
So there started another problem.
Yeah. So again, we need to have these hard conversations if we're gonna, if we're gonna get past this. Absolutely, we matter. It's been proven scientifically that a father's involvement in their child serves a vital role in their development. And what's funny is I've seen this on the flip side. With my son's mom not being involved, he still struggles to this day with how he relates to women. So point being is we're both needed for development. And I got some stats I'm going to go into. Luckily, I had a bunch of stats because of grants we wrote recently that show it plays into a lot of our problems in society. So these are stats from 2020, and I won't read them all to you, but it's eye-opening. 90% of all homeless and runaway children are from fatherless homes. 63% of youth suicides are from fatherless homes. 72% of adolescents serving sentences for murder are from fatherless homes. So the question we ask is, why is this not being taken more seriously? If you start looking at a lot of society's challenges, I'm not saying that fatherless homes is the only culprit, but it's a serious culprit. Before I was able to run this organization full-time, I ran a housing program in south of Seattle. And we house people coming out of homelessness. And one of our programs was specifically for homeless youth. And what was astonishing was 68% of them identified as LGBTQ. 72% of them came from fatherless homes. And of the ones that identified as LGBTQ, a significant amount of them were kicked out of the house because when they came out, their parents didn't. And yes, I forget who said the acceptance factor. Men do have a larger challenge accepting a child that comes out and a child that's diagnosed with mental health issues. I'm just owning it. So we need to change that. No doubt about it. So enough of the downer stuff. So again, it takes a village to raise a child, and we really want that to include dads. Two things we work on heavily: blowing up the definition of what fatherhood is, what motherhood is, and destigmatizing mental health. And, you know, I guess for me, I was able to accept my son's diagnosis a little easier, I will admit, because again, my ex-wife had severe mental health issues and my own mother committed suicide. So I swim in mental health. So it's a lot easier for me to accept, but someone said it and it's true. Men have a harder time with it. So in everything we do, we're really striving to empower fathers, to really encourage them not just to be involved, but fully involved. We will tell fathers, you need to go to the IEP meetings. You need to go to the counseling appointments. With mom or trading off with mom. In my case, my wife or current wife and I, we switched off, which lessened the emotional burden on each of us, and it lessened our burden at work. Video time. Uh-oh. This is a video of a gentleman who came to one of our retreats. I'm hoping it'll work. If not, it is what it is. If you can't find it, it's okay. Huh? Oh, yeah. No, worry about it. Yeah, we can move on. Oh, okay, that's fine. Yeah, we can move on. It's okay. It's fine. Stuff happens. Well, basically, Ray was a father that came to one of our dad's weekends, really struggling, and he's really improved relation with his son and acceptance of his diagnosis. So that's the moral of the story there. There we go. So we really try to create an environment at all of our trainings, our parent weekends, that welcomes people, welcomes them to get involved. And I mean, many of our members came as parents seeking help that are now involved with the organization. We work really hard with community partners, state agencies, other family-run organizations, other community organizations, to really create opportunities and to empower them to work with fathers better. We also are constantly looking for opportunities where fathers can get involved. By getting the fathers involved with different education opportunities, it really tends to empower them to really get more involved with their child's life. So one of the big ways how we start engaging fathers is with our Father's Weekend. So when we started as an organization, we did a Father's Weekend and a father support group. We have since expanded that to 2 weekends. We have a fall weekend that's for fathers, and we have a spring weekend that's co-ed, so moms can come as well. We're working on, now that we have a little bit more money, we're working on having a family weekend so everyone can come. All right, so I'm going to talk a little bit now about what we're working on, because it's going to greatly expand our work and who we're able to reach. So we are constantly expanding our trainings, and we've created an online training platform. We currently have 2 trainings on there right now. We're going to be putting on more. This allows people to go on our website and do the training in their PJs if they want, self-paced. We have created our own father-to-father peer training program that's a 30-hour training. What our intent is that a participant will go through our state curriculum and then take our curriculum as kind of a module to it. And again, the intent is we're trying to get more fathers working in our system as peers. Pierce County Fathers and Family Crisis Support. Pierce County is south of Seattle, so I'll talk about that in a second. Our King County Peer Expansion Program, which is modeled after the Pierce County one, and this is all within the last 6 months, so it's been a little crazy. We were recently named one of the SAMHSA Statewide Family Network grant recipients, and that is our 2nd one we've received. Again, we are modeling that to work with the other ones to get more fathers working in the system. DDA in our state is Developmental Disability Administration. We have a contract with them to provide what's called community engagement services, where we will go out with young individuals with behavioral needs and get them engaged into the community. And then John will talk about this in a little bit. We are fundraising to build an equestrian and training center in Eastern Washington on land that he is graciously donating to us. And our latest project, this is very new, so it's still in the works. We're partnering with the Department of Corrections to start working with fathers actually in the jails. So ideally, we will start working about 3 months before they're discharged or transitioned into the community, and then we'll continue to work with them afterwards, which that's going to tie into the training center, which we'll talk about here in a minute. Maybe. There we go. Okay, so our first one. For Pierce County, we have partners with Beacon Health Systems. So a little snapshot about how our state works. We have behavioral health regions. They call them Behavioral Health Administrative Service Organizations. And each region is overseen by a managed care organization, if that's not confusing enough. So we have contracted with them to build our learning management system, to have the online trainings. As I said, we have our first 2 up, which is IEP 504 and collaborative problem solving. And we have also partnered with them to fund mental health first aid classes. Also at Beacon, we have done the father-to-father peer training, which we'll have up here shortly. This is going to be kind of a cornerstone of our other projects, particularly our one with the Department of Corrections. Our intent is to run the fathers through this training to, one, help provide them skills for working with their children when they get reintroduced, but also to give them work opportunities. Because as many of us know, 2 of the big issues when anyone gets released is housing and employment, which puts them at great risk of getting in trouble again because they go back to what they know. So our second contract that was awarded to us by Beacon Health is, this is actually the name on the contract, it's the Pierce County Fathers and Families Crisis Support. We have already retained them. They actually start Monday. We have 2 father peers that will be working with fathers that have kids in our crisis system in Pierce County or coming out of detention. So they will work with them one-on-one. We are also working with the crisis providers in the county to where if they're already working with a family, we can work with the dad while one of their peers that's on staff will work with mom. Our King County one, which we're hiring for right now, was again modeled after Pierce County. We will have 1 peer that's focused on urban King County, which is like Seattle, and then another one that's focused on the rural part. And again, it's intended to work with fathers that have children in crisis services. So we've been contracted with DDA for what, about 1.5 years now? Yeah, so we have 1 person on staff that takes out people. We're hiring for other ones, and our hope is that when we get the equestrian center up, that people that are involved in this program will be able to utilize the equestrian center for different programs there. Right now, we're primarily serving two counties. We're trying to hire more people so we can cover the whole state. Whoops. Whoop. And I will let John talk a little bit about the equestrian center.
Hi, how's everyone doing? Anybody falling asleep yet? So the birth of the equestrian center came to mind that through equine therapy of working with horses and animals, which was, you know, it's upcoming. It's a big thing that's going on to help these children and parents. We already have the horses. We have hypoallergenic horses for those who are allergic. We're going to work with the lifts and stuff to get the kids onto the horses. And with the first part is building the equestrian center, arenas and stuff with the horses to get all that set up. And then after that, we're going to go into the training center itself, to where it'd be a nice sized building for people to gather and then have lunch and everything else. I got to learn talking to this mic. And then after that happens, we are going to build a housing project for the parents to stay at so they can actually stay at the equestrian center and work with their children for however long it takes. Then we are currently trying to contract with DOC to work with fathers and mothers coming out of the Department of Corrections and work with them to transition them back through the equestrian center into the community. So the whole idea is to get all this done and help the fathers and moms become peer counselors and get jobs and do our trainings. And within those trainings also, we are going to help them learn how to sustain their families, how to actually cook and preserve foods, how to grow gardens, and just take a lot of that old time stuff and help them actually learn to support their family and sustain it and work with their children. And this project it's an immense project, and it's like each piece me and Nelson worked on for about a year and a half, I think. Each piece we put together and some new idea would come up. Well, why can't we teach these dads and these moms how to actually cook and preserve food? I've done in my life and I still do it. You know, I have goats milk you can turn into cheese and so on down the line. And then you have the goat for meat and stuff come the fall. And then you have new babies, you know, it just keeps rotating. And you can do it with several other animals too. The biggest thing is, and this is kind of exciting, a lot of people from our state are looking at this project, and federally too, like Samson and stuff. If it's a success, they want to copy it. They want to copy it to another part of the state, and we've talked to other people in other states that would like to see it as well. So we're kind of hoping that all these parts and stuff that we got moving, it all comes together to help the moms and dads with their children with disabilities.
So I guess you could say we kind of go on the saying of go big or go home. So actually, before we get into that, I just want to mention real quick, you know, some of the other things we're constantly looking at new things just based on our work. Like we're hoping once the training center's open and then as other stuff comes up, we want to start doing financial literacy courses. We're talking about doing first-time home buyers courses because again, one of the things we've noticed is a significant amount of our families that we work with are low income. So let's give them financial literacy and let's give them stability of owning their own place. So again, we're constantly evolving just based on doing the work and observing the need. Yeah. Are there and there? Are in there.
You mentioned you that y'all offer. What is some of the curriculum inside of the training?
Okay, so
I can answer one, and that's we do a 24/7 dad training program. It's 25 hours. It's on how in the curriculum.
That's weird.
It's an hour and a half each lesson, and we teach dads how to deal with their feelings, how to deal with their behaviors, how to communicate with their disabled children, and how to communicate with their spouse and make it all work together.
I knew we skipped a couple slides.
Oh, did we?
Yeah, darn tech issues. That's okay. Who was next? Here.
There was a comment, a follow-up question. First, I want to thank you for even stepping out with that. See that you are in Washington and issue that goes where I'm at in Syracuse, New York. When are you going to expand?
We have talked to a lot of people even here. the previous Federation conference we were at. So one of the things I've actually pointed out to people is it's a subtle change. We have deliberately dropped Washington from our logo and other stuff. We intend on expanding. What our plan right now is, once we have, because right now, to give you an idea, we're going from a $60,000 budget to 1.8 million in the matter of 8 months. It just happens to be that a bunch of seeds we've been planting for a while just all grew right at the same time. So it's exciting, but it's a little, so once we're hired for all of our stuff, we got everything going. Our intent is to start looking for funding opportunities first in nearby states like Oregon, California, Idaho, and then going from there. There, and there.
Getting this and I didn't make it as a guard because I was actually a midday guy. And I didn't conform to how the leadership. I was not, and I did not, and I was in trouble every single day here for me. I was not. So besides that, these a large population that have built these fathers that have not paid their time. Where life happens. Like,
it does.
And it would break my heart that these guys had to sit in there with a lot of time.
And I hear this too much. And again, this gets to the generational thing.
Yes.
This was your example. Then you do that. And it's like, how do you break the cycle? So
they're implementing themselves right back into their children, the level of capacity of their children now. And they want to get in and they want to with the dad.
right. So to answer your question about availability, so this is where we're at right now. So we have, as I said, 2 of the curriculums on our learning management system. We're currently doing all of our trainings on Zoom, which is really what gave us, the pandemic was eye-opening for us. So it really gave us the knowledge we need to think beyond here. So everything's available on Zoom. We are planning to go back in person, but still do everything hybrid. And again, we're planning on adding more of the trainings onto our learning management system. So it's available there. And then further down the road, we've already started talking to people about traveling to other states to do trainings. So it's all on the table. We just need, unfortunately, it all comes down to money. So we've thought a lot of this stuff we've been wanting to do for a long time, but as the money's coming in, yeah, we're open. Or I'm sorry, you were next. No.
So I know you say originally after
Well, a couple things.
How much does it cost to start this for a start?
It's been an interesting journey. I mean, one of the things I'm proud of is we are beholden to nobody. We were no one's pet project. We didn't start out by the state. We started out by 6 guys who had a vision, and we all pulled our money out of our pocket, literally. For years, years. We pulled our money out of our pocket to file the 501c3. We literally, at times, for many of our early years, paid for manuals to do trainings. So it's not easy. I'd say, you know, for starting, you know, you have to really have a vision and believe in that vision and be willing to fund that vision yourself until you can get money. And probably our big break happened. We were all volunteer until 2018. In 2018, we were awarded our first Samson Network grant. That allowed us to put John on. I was slowly, but I couldn't financially quit yet. So I have only done this full time for the last 2 years. And the only reason I was able to do that is because my wife and I sold a rental house and I paid off everything. And literally I quit, what was it, a $68,000 a year job for $1,300 a month. With the hope that if I put in the time and could start writing grants, that it would change. It has. It also helps that that job I had, I stole their grant writer.
It gets rough at times, and the whole thing is don't ever give up.
You don't give up. You got to believe in your vision. Number on what?
How much it will cost, like, start things up to get?
Probably $3,000 at least. You need to have your insurance. You need to have your fees for filing your 501c3 with the IRS, your articles of incorporation with your state, and then some seed money to start paying for basic supplies for doing trainings.
Then you're going to spend money on gas and food and stuff yourself and travel to certain areas to do the training just to get it out there and keep going and constantly.
Right. There and there.
Yeah. I was just going to ask kind of a two-part question. You've answered the training. Parenting classes. So I volunteered for CASA for years, and some of the parenting classes I sit in was strongly had the 5-year-olds in the parenting classes. Like, you know, they just talking to the parents, they kind of talk to the mother one way and the father another way, instead of, you know, like you can do this, and both parents can do the same thing. Like this is what you're going to do. And so what's your thoughts on, do you know of a parenting class curriculum that is kind of neutral in that? And then the second thing is, how would you advise us that works with fathers to have them to talk with their employers? Because if a mom takes off from work for a job without a woman, both work, well, she's the mom, she has to. But when dad asks about, they're like, don't we have a mom that she here, or why are you having to go?
So one, I'd say there's not really a curriculum. And I don't even know if this is my opinion I'm injecting. Moms and dads are different. So I'd say we do need different things, but where we've kind of missed the boat is we both need equal attention and we both need equal support. That support may look different for her, may look different for me, but we should both get the support. As far as employers, that's something we're going to work on because it's a big problem. And I'll illustrate my own story. I remember going into the office of my manager at Metro, and I told him, hey, this is what I'm dealing with. And he goes, where's mom? Why are you dealing with this? And I looked at him and I said, I am mom. And he goes, well, you shouldn't be. there's a lot of, I tell people this all the time. We have a lot of biases in our society. It's not just racial, it's not gender, it's all sorts of stuff. And we got a lot of biases to break down, a lot. I think you. No, we partner with anyone, and we try to get the word out to anybody. And as far as the behavioral health organization I mentioned, they believed in us. And actually, one of the things I will give them kudos on something was what we've done for years in our state is the different regions would just automatically contract with the same organizations. They've contracted for years with the same poor outcomes. And this past year, they decided, you know what? Instead of just doing that, we're putting it all out for bid, which allowed a few of us new players to get in to provide new services to the community.
So going on that, I'm just trying to put together how we work with this partnership with clinical companies. So what that does is offers the opportunities, the area that we see to bring awareness to maybe the youth.
Right. I think, to answer your question, I think we're heading there, particularly with our new projects. I've already started forming partnerships with different behavioral organizations. So we're heading that way.
Because it's a change that's definitely necessary. And if we can come into that place, like we're already set up as a in that kind of program. So what would it take to bring that into it?
You know, I just think it's getting creative with the funding. It's taken us doing a lot of outreach. Outreach is the one. One, that we exist. Number two, the importance, which is really, it's an important shift we made that I honestly think is part of why we got our recent load of money. Is we started a shift really focusing on the statistics. Not just that it's a good thing to support dads, it's vital to our society. So I really think that's what it's about, is education on the importance of, and I'd go even a step further about illustrating that you will actually save money on the long end. I hope oh boy. Back there, you. I'm trying to keep track of everyone. Yeah, go ahead.
So I go back, but the gentleman in front of me was asking about parenting. I do surplus here. Both of them have they go through all these, and then I started with dad. We had just got that for 6 years. He was out for 2 weeks, and the Friday that full drive there into with what surplus here was. The second week he showed up, he'd been up for 2 days. And discontinued counseling. I did everything I possibly did to get him engaged. And then as I was walking him out, my mom and I so that's been a struggle for me. But those parenting classes, circle security, is really great because it doesn't focus just on one parent. If they're not there as a unit, solely. And that is that. And full grasp of everything that's going on, but circle of security is in there. Very informative. I use it for
And what state are you in?
Oklahoma.
Okay.
Yeah.
I think we need to do some training.
Manning, y'all.
My question is, what percentage of your participants are African American? I said that soon because, as we all know, males are typically don't ask for help for one. Then be always considered somehow less not our own because of that. I'm just curious to see which
Admittedly, too low, probably less than 20%. It's actually, it's something we acknowledge, and we're working hard to better reach communities of color. And you're right, it's been a big problem. I will tell you, I'm half Cuban, and Hispanic communities have the same problem with talking about it. So that is something we're really going to strive to really work on, reaching greater communities in the coming years. So yeah, too low is my answer, but it's already on our radar that we need to do a better job.
Kind of like piggyback what you said, what you're saying, like, as far as dads and men in general, it's hard to even acknowledge that you have a mental wellness problem, more or less saying that you have one. And you say you deal with the incarceration. So my question is, for the men and women that's coming out of incarceration, in your program, do you prioritize their mental wellness, or you get them involved with some type of mental health services to make sure they can combat that, or at least have that conversation? Because even with prison, that's trauma within itself, and then come back to society, trying to not only walk on eggshells, because I understand that likely you will be on some type of supervision, probation, and just trying to reintegrate back into society and becoming a dad because you missed so many years or so many months of your children's lives. That can be a mental health challenge as well. So my question is, do you focus on or prioritize them getting some type of mental health services?
Well, first off, the working with in the corrections is new. So we're learning right now. What we're planning on is focusing on mental wellness, because it's something men just don't think about. They don't want to talk about, they don't want to acknowledge. So that's probably going to be at the top of our.
We'll get to you. One second. I didn't ask before, but I was kind of wondering how many of you are from a rural community? It's quite hard to get services in a rural community for mental health, period. I'm from a rural community, and all we have is first level. Anything beyond that, you got to drive 3 or 4 hours away to get the services.
Was there another hand raised?
Delph.
Yes.
Well, it's a big opportunity for my community because it's, like I said, it's a real rural area where I live. And it's really going to benefit the community. The people that are in the rural area right now that want the equine therapy and stuff, they have to drive 3 hours away or 2.5 hours away just to get that. You know, 3 or 4 times a week. So you're talking days off, you're talking travel time, you're talking meals over and everything else. So
I think I saw you had raised your hand.
Yeah.
Oh, well. Oh, okay.
Well, they had asked what demographics would be very familiar with county.
we'll look forward to it.
So I was asking about the outreach too.
Hi.
Do you do outreach like the native population?
Oh, yeah.
Oh, yeah.
I can't get away from it. I mean, I can go down my mountain across the river, and I'm on native land. It's all native, Colville Indian reservation. And the thing is, we've talked to them and did trainings for them in the school district. And they just love us over there. They ask us more. I've been to several of their main board meetings with the head chiefs and all that. And they want us to get into their DO system and work with their youth and work with their adults coming out of the DOC as well. So it's all coming together at once, and it's like, it's exploding. And it's very much needed, especially on the tribe as well. Maybe more so because there's a lot of more issues in the tribal communities. You know, it's like the bullying and stuff that happens on the bus and the tribe. A lot of the children, especially the teens, have a tendency to bully a lot because of the family they come from the native side. There were kids half beaten to death that they had actually carried off the bus to where their parents had to take them to the hospital as soon as they got off the bus. The bus drivers are not allowed to stop anything. They, you know, it's like if they go past the bus stop, that's it. They can't back up. Fight breaks out on the bus, they got to sit there. They can't do nothing. They call it, I can't think of the word, you know, if they intervene, they don't want to get sued and all that stuff. So.
Liability.
Liability, there you go.
There and there.
So I live in Utah, and I mean, you guys are only in Washington, but there's kind of a stigmatism in Utah where men aren't involved in mental health. For instance, I'm a peer support in Utah, and out of the 140 of us, I'm the older. How would you suggest like approaching that to advocate for more men and fathers to get involved with? Obviously, you guys started somewhere.
Doing events in your community?
No, I mean, that's the problem I live in. Like, I live on the reservation.
What's the problem?
I mean, yeah, I could start there, but even at the state level, what would you suggest?
I think reaching out, okay, for a couple of things. Number one, getting on any boards or commissions that you can. Several of us serve on local committees. I serve on the Washington State Behavioral Health Advisory Board. Put yourself in positions where you have a voice. That's number one. Number two, once you do that, really preaching the need. Learn the statistics, talk about why it matters. And then trying to encourage better outreach to get more men involved, because that's exactly, this is what spawned our programs, is how few male peers there are. And since the agencies weren't doing anything about it, we're like, we will.
Another thing is talk to your collaborative response systems, you know, like your ambulance people or your police department and stuff.
Oh, first responders
and talk to them, and a lot of times they'll help you get out to the community.
There and there.
Just a quick question, piggybacking on what you said in the back, earlier about as far as dealing with the Black and brown population. You said it was less than 20-something%.
Yeah.
And is that, when you say that, is that because of, is it you guys, is it a referral process, or do you guys go in that community, or
both?
how is it? Is it, or was it just a rejection or because of, you know?
We have found that many people, not just men, but many parents from not just, you know, a variety of communities of color, immigrant communities, Hispanic communities, African-American communities, there's a definite cultural stigma to talking about mental health, talking about the problems. And so we just consider that part of our work. We're trying to destigmatize that. And I would just acknowledge, and I'm part of our problem has been staffing. I'm hoping now this will solve itself. Now that we will have more people, I fully intend on doing much better job of outreach into Hispanic communities, immigrant communities, you know, African-American communities, and do a better job of that. I think it's on all of us that serve to do outreach and acknowledge that sometimes those communities have a harder time talking about it.
And to touch on that, you're gonna run into certain communities that are not gonna want you there.
And that's the reason why that's the reason why I said that. So when you're doing your hiring process, is that going to be more or less like to, you know, challenge the different areas, like hire some?
Yes. Yes. Okay. Yeah, who I see two hands. Okay, gentleman there, then there, then there. Yeah. Oh.
I run a men's support group, and the population that I serve is mostly individuals that have dependency cases. Are any of these trainings and intervention treatment support cases, is that available only in your area or people outside the area?
So, I mean, obviously the ones in person, if you want to fly to Washington, you're welcome to come. All of our virtual stuff is open to anyone. We had a dad on one time from Boston on our dad support group and one time from Jerusalem.
It reaches out.
Yes.
And another thing I like to mention is at our table, at our booth, we have our brochures and we have a list of our trainings. We got
if there's
26 or 27 trainings.
If there's any left.
We do constantly throughout the year, online, you know, in person if we can. So anybody wants to stop by our booth and grab that, it'd be great. Or go to our website.
You've been waiting. I'm going to go back there. Sorry about that.
But my question is, we've been asking the question, you said there's 20% of Black and brown that's in your area that you work with or help, am I correct on that? Dealing with, do you have people covered?
About 20%.
Recognize anyone who is successful enough to go in or come and partner up with you guys, because what I've noticed is I have the same issue when it comes to when it comes to working with a white guy. I'm in Atlanta, I'm in the Bronx of Atlanta, and he knows. Is that standoff south, first of all, and you're out here trying to help. So, but now we have a white gentleman that works with us, that we recognize it, and he works with us. Now he's having success in the white. I know that if I was in an issue with crisis and you came to talk to me, I'd be scared of. So I think one of the things what I'm asking is you can't go, you know how they say in the Chinese community, they're not going to talk to the police. So you got to have a Chinese police who's going to talk to them. I think that's and men and children.
Yeah.
You understand what I'm trying
I
to say?
understand what you're saying.
What I'm trying to say is, I think it's 20% because we're overlooking that violence. And I might say that the same way in Atlanta.
Yeah. That's the whole point of why we're trying to hire father peers, is so a father who's in crisis has someone they can feel better to connect with. We naturally connect to people who are like us. There's nothing wrong with that. It is what it is. Now, me personally, I'm fine talking to anyone, but then again, I'm originally from South Central Los Angeles. So I kind of don't care, but yeah, but so as I was saying earlier, we acknowledge we need to do a better job of reaching different communities, and what was holding us back before was lack of staffing. Well, now that we're going to have more staff, I'm really going to concentrate on that. Yeah, money. Unfortunately, it all comes down to money. It just is. But this coming year, I hope to do outreach into different communities, do actual trainings in those communities. So I'm working on that. So we have a plan to try and overcome this.
I feel like it's less about the outreach in that community, more about the representation.
Well, and that's a good point. What I'm hoping is by doing better outreach in the community, we will get members of that community to come work for us. Because you were 100% right. We need to have people working for us that community feels comfortable coming to. 100%.
So it doesn't matter how comfortable we are. I'm comfortable. But he made a valid point. Someone being like him, and then he had to go to the next level, like psychiatrist or something. His current therapist looked like him with it. And it just something about making her feel belong.
Some people connect and some people don't. Some people have. It's an ongoing problem.
Well, like one of our new fathers that we have hired for one of our new projects identifies in the LGBTQ community. So, we're even trying to work better in those communities. So it's a work in progress. Is there a hand over? Yeah, I'm sorry. Back there and then here.
Young men, but I can't really any like a friend or anything like that. Because it's basically in the city. In the city, you don't have a lot of black males. A lot of them are staying up front. They have and they think they're going to have to get child support. So I'm trying to see how to spend the government. Access, like in the city, black young men who work with the organization.
Yeah, that's my hope, because let's be honest, the whole prison, pipeline to prison. Well, let's look at those homes. They have no father involvement. It again goes to that generational cycle. How do we break it? We need to support. We need to educate. You know, it reminds me of a story of someone who came to one of our early dad's weekends, and I happened to knew him from previous work for a social service agency I worked for. And he was talking about struggles with mom. I won't bore you with all the details, but then he made a comment to me. He goes, I go, well, why don't you just go to court and get custody? And he laughs. He goes, I can't do that. I'm a black male. And I'm like, so? And he goes, well, you don't understand. And I'm like, oh, you're right. But my answer is still the same. So what? I go, you care for the kids, right? He's, well, like, yeah. And I go, you think you do better than mom? He goes, well, absolutely. I'm like, going the hell with it. It doesn't matter that you're a dad. It doesn't matter the color of your skin. Go prove your case. He did get custody. Here, there, and there.
So to kind of go along with this, I am a mental health advocate also. Washington State has some of the highest population of Native Americans also.
Yes.
Have you guys looked into partnering with HHS and on reservations and stuff?
Yeah, like I mentioned earlier, I've been on the board of chiefs for the tribe and talked to them. And they want us to get involved with the DOC and the youth coming out of DOC and help transition them back into the community. So we've been on the reservation several times. We did trainings on the reservation. They love us. They want us to come out and do more. And then again, like it boils down, or comes down to money and the funds just to get out there. But being where I'm at, because I'm like right on that line between the reservation and you know, the part of the state, I can get tribal people into my events. I can get tribal people into my trainings, you know, from both sides. So it's kind of a plus for me. But
it kind of goes with what they're seeing too, like hiring people. I'm indigenous. Yeah. I don't look indigenous, so people don't trust me where I live for 20 years. So where are you looking at?
Yes. Oh yeah.
When I first started reaching out to the tribe, the key to that was to actually go in front of the tribal board members that run the tribe, ask their permission to get onto their reservation and do these trainings and do these outreach, and they agreed to it. Once I explained to them like we did with the PowerPoint. Once I explained everything to them, what we're trying to do, they agreed to everything and then wanted us, like I said, to work with the OC and the youth and stuff. And that's a big thing.
That what you say, as far as custody. Most of the times, without or joint custody, a lot of men don't know that. But you got to put yourself in a perspective to be able to say, I ask them whether they stay with you. You know, maybe state guys, what to say, social services, but then I'm not very well, and have worked us where and child support for years.
You're absolutely right. There and there. Or actually, I think she was first. Real quick.
Whoever else, it's been my experience working inside that these men of all color want that.
Oh yeah.
And it was more than often on Father's Day, on Mother's Day, like you walk those homes that bill, it was so hell. And it was so hard. And you heard the sobbing. And you heard the cry. And I was the one that would stop. Kept getting trouble, but I stopped. Also, that was just a statement, another thing. When people come inside the jail to teach, or to do a course, or to do, look at inmates and sort of like, they do not respond if you come in and your hair is all done and that makeup laid
you got your boots on and they're shining, go in there and just be real. Like that is when you're going to grab that in me. Also, the ones that come out and they turn their lights around and they go inside that field, that's transformational. That is no inspiration on where they.
It's very powerful.
So bad, so bad.
Hey, I love to travel.
So, as Black men, like to point things out, things like that, but I'm also a man of accountability. So therefore, we also have to point out the fact that in our Black communities, we love to point the finger, oh, there's this, that, and so therefore we let the hypothetical stereotype around, hey, we can't do this, we can't do that, stop us from even trying because we hear so often, oh, Black men ain't getting this, Black men ain't getting that, man ain't getting this, man ain't getting that. When in reality, we really don't know because we're not taking enough action to go inside of those places to get real statistics behind whether or not you can or cannot get that child.
You're right. And a lot of what we're about is accountability, advocacy, and empowerment.
So I wonder if there's any moms involved or help bring this into seeing that it's positive, being part of trying to, yeah, it just doesn't sound right when you say it, but I'm just thinking it's great to have moms that have seen that it works and it's helpful.
You had something to say?
Well, I was just gonna say, a lot of the moms will push the dads into us.
Yeah.
We had a mom that pushed her husband into a retreat. I think there was a picture of it on the video, or on the PowerPoint, if I remember. She pushed her husband into one of our retreats. And he was having issues, all kinds of issues, and through that retreat, kind of worked with him a little bit, did trainings, the PowerPoints. Then we went to
the last Federation, Phoenix.
Phoenix. We went to the Phoenix Federation, and the mom showed up there and spoke up and said how much we helped her husband and how her husband had changed.
She actually said we saved her husband's life because he was suicidal before going to our weekend.
Moms are a big part, so moms do push their husbands. You need to go to this. And we do have moms. We do have moms on our.
My wife is a quiet support behind everything. She's interesting because of us raising three very difficult kids. When we got them raised and out of the house, my wife was, yeah, I don't know where that came from. My wife just kind of wiped her hands and said, I've done my job. She's like, I'll support you doing that, but that's your thing. So she's the quiet support behind me. She was actually our first accountant. But we worked very hard to get away from that because it didn't look good having the director's wife handling your money.
For me, it was my animal. So.
Another hand. Sorry, I'm trying to keep track of them.
I personally just want to thank y'all for coming and opening this space. Specifically ran away from within, and as I continuously said, especially within Black men, we have Black men represented. Those have been one of the most vocal people in this session. So therefore, that just goes to accountability stuff. What a program like this can really do, and how much dedication that men want to do to better this, but also takes this to have to open that door to great sense of accountability, oneness amongst fathers and men to be able to encourage others to push the children.
I think more men than not want to be good fathers. They don't know how.
Right.
They haven't had good examples. I don't think I mentioned this earlier, but so my father being from Cuba, he is very much old school thinking. Mom's got this role, or man has this role, woman has this role. very Neanderthalish, but but in any case, when I was fighting for custody, I remember having a conversation with my father on the phone, and he asked me, he's like, "What are you doing?" And I go, "What do you mean?" He goes, "That's not your job." He goes, "That's her job." And he said, you pay your support, but that's not your job. Why are you doing this? And I said, well, with all due respect, I'm not you. In my particular case, I was, as I mentioned earlier, my first wife was very mentally ill. If I didn't go for custody, I was failing as a parent. And that's why, and I will say later on, probably about 8, 9 years later, I was visiting my father, and he actually pulled me aside and apologized and acknowledged what you did was correct. Yeah.
Just real quickly, I think that's an important thing. So I lost my father to a drug overdose. Years later, I realized there was some self-reflection and all of that. A lot of me and my father had a very strange relationship. And I look back, I was partly to blame for that. Today, I look back because I was expecting him to be the dad I wanted to be instead of the dad he was capable of being. So I didn't appreciate the things he did do because that's all he did do. Because I always wanted something different. So
Right.
I think that's important. So with the thought of the different cultures and back to their community and all that, and the different communities, like, you know, whatever it is. What is your thought process on mentorship for school age? Because I think our biggest problem, I'm just here speaking from outside looking in, because I don't know what it's like. But the lack of education for our kids in the poor community and those communities, they always see one thing. So these fathers that you're working with that has made this change, bringing them into some kind of school system setting to teach these younger kids that you don't have to be afraid of your color or your economic stance or anything like that. There is a way out. So I think that's something that's really valuable.
Yes, and some of a couple more things that we're working on that I'm hoping will start going in the direction that you're mentioning. We actually just recently did a presentation. We're going to have more to one of our youth correctional facilities, and it was specifically geared towards the guys that were already fathers. They were due to get released. We will also be starting a program through our state's Division of Child Support. That's actually, it's unique. They got a federal grant. They're actually going to go around to vulnerable young men who are not fathers yet, but because they're vulnerable, they're at risk. And we're going to go in and start doing education around, you know, concentrate on getting their life in order and put off parenthood until they're ready so they can be the best father they can be. Right back there, then you in the yellow shirt. Oh yeah. I agree, and it's funny because my experience is a little different because my family had such a history of severe mental illness, and I had a son who did. I made an unusual decision when I was young. I got snipped. I deliberately did not have more than one kid. I said, you know what? The genetics are not in my favor. So I decided not to have any more. And I don't know, I mean, that was the right choice for me. I'm not saying it's for everyone, but you know, I'm like going, nah, I'm not going to do this again. Go ahead.
So with implied is common. I'm personally going to challenge you all to go into the school system. You already got this curriculum now geared towards a way that you can bring in the father or bring it into the school system, because at the end of the day, the way you stop fathers from coming in later is done with now. Teaching the kids, and then it conducts. So you can have a kid portion, and then you have a father figure portion to realize the kids to know, for them to create a safe space to acknowledge their fathers or point out and call something to calling out, but in a healthy way. Call out their parents to be like, hey, this is what you're doing, this is wrong, and things of that nature, because so it now then incorporates and instills in the kid that these things are not the right things to do or better things to do, because at the end of the day, kids in the school system are suffering, and like you said, it's the lack of education, not just from the parents, from the kids as well, and that's how you continue, like Drew said yesterday, those intergenerational curses and things of that nature. Education is power, so therefore, education one generation, and that's the change of it.
I am taken up on your challenge, and I'm the other thing that we're starting to work on is we're hoping, and I think we're close to getting this done, to start going into our youth correctional facilities and doing trainings to educate them young. They may have made some mistakes already, but you know, education is key.
The one issue I've had in my area of going into the school systems and teaching is they kind of push me out and say,
yes,
you know, we already have a bullying curriculum. No, you don't. No, you don't. The state or the nation requires you 45 minutes. That's what you do. You hand them a sheet of paper, let them watch a video. I wanted to go in and teach bullying of what's going on. And I said, I'd like to come and teach a 4-hour class, and then maybe halfway through the year, a 2-hour class on youth. And they just pushed me out. I had to go to the superintendent, and he was like, no, can't do it. And that's my world. So, you know, depends on the school system.
I think we're running out of time.
I know that in the beginning you were talking about the basic needs, and I think that's when you're talking about the juvenile system and these things, like they aren't going to listen to you or hear you until their basic needs are met. So we're top of it, other things, creating a barrier to them being able to receive that. So I think you guys already have something in place where you're trying to do that.
Yes.
But also maybe to do that at that lower level. And then it's a way to connect with the families and get them in a more substantial business. When they come out, they might feel better when they go back to the same situation.
Yes, and that's where I'm hoping we head. No, I know what you're talking about. I think I saw your hand go up.
So in the school system, you got to kind of coddle them because they're very protected in the CEW, the virtual facility. You better jump up their butt as well as possible. And the reason why is because they respond to that. They respond to that.
You're right.
Yes. 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 Absolutely. And I also did want to make another statement based off of, you know, my experience where I was, the situation I was in, or, you know, the whole jail scene. You would hear the male inmates say, well, I didn't have it at it, so why should I care? And I was, it was so great. I would be the one to tell them, but you are the curse breaker. You break those chains. They would ask for literature. My dad did work in 25, 26 years. They would ask for his phone number.
he was the only person I knew that could give them any kind of advice or anything on how to be a dad when they come out. And he told me it so much. So
we have to keep talking about stuff. I mean, I was told by many people when I was younger that I'd be dead or in jail by the time I was 25, because my mother committed suicide at 13, or when I was 13, and then I went and lived on my own at 16. So I was high risk.
And those are stories that I've heard. I appreciate you all.
Thank you, everyone, for coming.